Kenyatta National Hospital's casualty area remains deserted for the third day as the facility continues to run on a skeleton medical team owing to the withdrawal of 700 doctors on training protesting the suspension of their colleague involved in the brain surgery blunder. Mwasia Wambua's family is at a loss for what to do. His brother-in-law urgently needs a second operation on the head.
Upasuaji wa kwanza alinifanyia kwa coptic. Akaniambia ni ya kutoa maji, ile maji inafanya hiyo growth hiyo kwa kichwa, ni ya kutoa hiyo maji. Lakini upasuaji wa pili akaniambia atanifanyia Kenyatta. Sasa nilipompigia ameniambia wamegoma.
A private doctor is charging a 250,000 shilling fee to conduct the operation, money they do not have.
Mimi nampatia tu namnunulia painkillers sababu anaumwa sana. Painkillers zenye anatumia ni bei kali sana. Si hizi Panadols.
Following the strike, the hospital is offering only 15% of medical services.
We are now forced to take extraordinary measures. Extraordinary measures would mean I have to be reasonable. If I have a patient who's bleeding here, it will be foolhardy for me to be removing your goiter that you have had it for 10 years, isn't it?
Meanwhile, the hospital says the two patients who have been the subject of a raging debate following a botched surgery have been discharged. They, however, leave behind a hospital in disarray and Health Cabinet Secretary Cecily Kariuki in trouble.
We are proceeding, we remove her, and we have many Kenyans who are qualified to be CSS.
Already 143 MPs have appended their signatures to the petition seeking to impeach the Cabinet Secretary. The impeachment motion is set to be tabled on Tuesday. The Health Committee, however, hopes to begin an inquiry into the terrifying surgical error that Tuesday.
Nobody has really gotten the real story. We need to give a chance even to the CEO, to the board, to the people, the doctors. We want to know what really happened. So we only want to ask Kenyans, let us not be a nation, even our fellow members of parliament, a nation that we condemn.
At the same time, the Kenya Medical Practitioners and Dentist Board says KNH has furnished it with a report on the incident alongside certified copies of the patient's files. The medical team involved in the surgery mix-up have also submitted their statements. Board Chairman Daniel Yumbia is summoning all parties involved, including relatives of the two patients, to appear before the board's preliminary inquiry committee on Thursday next week to give their accounts. Sylvia Chabet, Citizen TV.